So what we should do in this case, and that's what I did. I did the LFT, E antigen, DNA, and also the IgG and IgM antibody. I am showing the genotype, but sometimes you can miss it also for Hep B. It is not so much of important. It is a costly thing to do. You can skip it, there is no issue. But the rest of the things are very important on we should do. So if a person has got Hep B, if it is positive, then what we should think of immediately, whether it is an acute case or whether it is a chronic case. Why? Because we have to treat or we don't have to treat. So this is a big issue and we should resolve it. In acute hepatitis B, what happens? Actually, basically, it is recent exposure, jaundice, and if ALFT, mainly ALT-AST is more than 500, means it's acute viral hepatitis. And what is chronic? Is a chronicity more than 6 months if it is continuing. It is a chronic liver disease, and chronic liver disease may be again with liver disease or without liver disease. Positive may be there, but the sign symptoms of liver disease may not be there, or with may be there. So this is very important because your line of treatment will be decided on this one. Here, who to treat? Already I asked, is it justified to put the antiviral drug to anybody having the virus positive? So here we'll find the question and when to treat. Here, acute viral hepatitis, very clear, we should not have any doubt about. If it is acute viral hepatitis, no treatment required. You just follow them up. If it is chronic hepatitis B with liver disease, then treatment is a must. We have to treat the patient. But if the patient has got chronic hepatitis B, but without liver disease, what I showed earlier, then again, we should follow up. Don't treat him. So how can you know that it is acute or it is a chronic? Again, if the IgM antibody is positive against core antigen, so that is your acute viral hepatitis. If the IgG is positive, then it is a chronic viral hepatitis B. So from here also you can identify whether it is acute or it is a chronic case. So on 14th June, this man came to me, so we did the checkup. LFT normal, E antigen negative, IgGM is negative, IgG is positive, and DNA is 20 ml. It's very low DNA level. But here it is very clear, IgG positive means it's a chronic case, but he does not require treatment because why? Probably I'll talk after 2-3 minutes. What is next? Any more investigation we need it in this case, in this person, or we'll treat the patient, or we'll follow them up. So always you justify what you are doing. Let us see what we should do. You follow up. The question is how to follow up, for how long to follow up, at what interval we should follow up. This is the answer here. Every 6 months we should follow this up. Usually it should be done every 3 months. But point is, in India it is not an easy job. It is a costly test have to be done. So later probably we can do it every 6 months. And what we should do, you repeat this test. Surface antigen, E antigen, quantitative Hep B, alpha fetoprotein, portal hypertension. You do a fibrosis scan to see whether they have got fibrosis or not. At least we can do this thing easily nowadays. After 6 months, again, I asked the patient to come for follow-up. He came. This time, what is the result now? Surface antigen is positive, ALT-AST normal, but his DNA is below 20 level. So again, it is very low. We don't have to treat. So I'm just giving the question, should we treat them? I think no. Why? We'll talk later on. So after that, I lost the person for checkup. So after 3 years, he came back to me again. This time, ALT/AST is normal, but his DNA level is 984. So it is not normal but higher. But whether it required treatment or not, that is another story. So will you treat? Yes, again, probably no. Why? You can know after 2-3 slides.